Good morning. My name is Krista Mistowski, and I'm the Director of Public Relations for Community Hospice. I'd like to welcome you to our Community Connections seminar today on healthcare fraud and scams during COVID-19. A couple of housekeeping items. If you have any questions during this presentation, we will address all of them at the end of the presentation. Please go ahead and enter your questions by typing them into the chat field, and I will respond and we will address those questions at the end. Our speaker today is Sandy Howell, and she is with our local HICAP office. And again, she'll be presenting on healthcare fraud and scams during COVID-19. We're grateful that you joined us today, and we hope you enjoy your presentation.
Thank you, Kristen. Thank you for welcoming us here, and thank you, Chris, for your assistance. He's IT, and so he is extremely special. So my name is Sandy Howell. I am a HICAP counselor, the community educator for HICAP, which stands for Health Insurance Counseling and Advocacy Program. I'm also part of what is called the Senior Medicare Patrol that does a lot of fraud prevention, education, and outreach, and that is mainly what we're going to be talking about today. So we're also the advocacy, we bring the experiences of Medicare beneficiaries. Go to the next slide. Thank you, Chris. Oh, okay. So we bring the experiences of Medicare beneficiaries to the public, and especially legislators and their staff at federal and state levels, and through media and educational campaigns. Our policy is to conduct public policy research to support recommendations for improving rights and protection of Medicare beneficiaries and their families, education to provide timely and high quality information on Medicare, website sheets, policy briefs, and educational workshops. So Senior Medicare Patrol, like I said, is fraud prevention, education, and outreach for the entire state of California. So we're with the Stanislaus County HICAP office, and that's over on Coffee Road. So what I'm going to be talking about today is COVID-19, the healthcare fraud and COVID-19 scams, which during this COVID virus time that we have is kind of challenging for quite a few people. So in August, this is August, and since March, we have been filled with a lot of uncertainty, misconception, confusion, anxiety, and fear. The data is outstanding from the National Bureau for Health and Statistics. And in California, we rank number 17th with this data. And the people that responded, the adults that responded, 40% of the people in California, adults, are anxious or depressed. It's our older adults who suffer more from this confusion and fear. So according to the CDC, COVID-19 world, our seniors are at a higher risk that shows up in fear, worry, stress, and the criminals will feed off these emotions. They incite fear. They pressure people to give up their information, their Medicare numbers, their Social Security numbers, and their bank account numbers. Social Security is one of the calls. These are some of the things, some of the scams that are happening now. One of the big ones is the Social Security scam robocall that is scaring people into believing that their benefits have been suspended. The call says it's time sensitive, it requires your urgent attention, and this is just to, again, get your name, your birthday, your Social Security number, your Medicare number. And make no mistakes, the criminals, the scammers are out there to steal millions of dollars from Medicare and inflict as much harm on our seniors as they can get away with. If that isn't bad enough, our seniors are lonely, isolated. Many face language challenges that make them extremely vulnerable. Case in point, a woman got a call from a COVID team. They sounded friendly. They started out sounding friendly, then began to pressure her into giving them information. They wanted her name, birth date, and Medicare number. This is a call that happens many, many times during the day. And the scammers are thriving. And each year they're coming out with updating their scam problems that they can create. So one of the things is the offers for scam COVID test kits and fraudulent COVID testing billing, telehealth, telemedicine fraud, contract tracing, fake websites and charities, stimulus check fraud, and genetic testing. So Medicare, here's the important thing that we're going to talk about today. Medicare covers your Part B virus test. There's no cost sharing. It's covered under your Part B. Medicare covers the test at laboratories, including some parking lots. Medicare Advantage plans can't charge copays, deductibles, or coinsurance. And Medicare covers COVID-19 antibody tests with no cost sharing. If you didn't know these rules, you could be tricked into giving information. But now we're going to talk about the facts. We can keep people from falling victim to scammers because you know the facts. Since there is no cost sharing, that's important to know. That Medicare covers these tests, that's also important. That Medicare Advantage plans can't charge copays, that's also important. And that they do cover the antibody test with no cost sharing. So here's what we want you to be aware of. The scammers will try to charge for the test. But now that you know this, you know that this isn't an accurate call from a scammer, that it's not the government calling you. You will receive calls from the government, and if they say that the government is mandating that you take the test, it's not a mandated thing. All scammers want you to do is give up, again, your birthday, your Medicare number, and your Social Security number. So they claim you can get money for taking tests. I'm not sure how many people out there have gotten the calls that are saying that you could get the test, but it's going to cost you some money. That is a scammer. The best advice is to always check with your own doctor. That's really important. So here's a story. Actually, this happened in Central California. There was a doctor that advertised for COVID antibody testing at a drive-through. He had TV interview promoting safe and accurate tests. He was doing this out of a parking lot at a high school. He had several seniors, they had their blood drawn. They had to pay $50 each out of their pocket. They signed paperwork requiring payment in advance. And seniors were told they must submit the bill to Medicare. Seniors received the Medicare statements, and on the statements, the doctor had billed them for an office visit and other services. So this is an example of what you might think that it's an actual doctor, but is not. And then when you get your Medicare summary notice, you notice that there are additional charges, there are services that you didn't receive. And I'm going to explain to you one of the things that you will need to do when that happens. You will need to call the HICAP office, and I will give you phone numbers for that. So that's really important to remember, that if you become a victim of a scammer and you've given them the information, what you have to do to reach out to us. So here's another. We've got a lot of stories. California laboratories, what they're doing is some, not all, some are legitimate, most are legitimate, I might add that. California laboratories are now recruiting marketers. They pay the marketers money to go out and get information. And one of these marketers accosted an older gentleman in a coffee shop. They offered him a free COVID-19 test. They drove him 10 miles to a facility. The Medicare statement showed that when he received his MSN, his Medicare statement, it showed that they had billed Medicare $700 for lab work, over $500 for ultrasound, head, neck, and abdomen, $200 for a podiatrist, and he did not get the COVID test. He didn't receive all these services. So the critical part here is that once he got the Medicare summary notice, he realized that he had been taken advantage of. So another item that is happening at the moment is Medicare telehealth coverage. Office visits for psychotherapy by an eligible provider is using interactive two-way telecom system. Well, this is new because of social distancing and getting into the doctor's offices and making sure that you are safe and protected. So they're also doing audio visits in nursing homes, and they do it from your home. So Part B covers certain telehealth services. Part B will cover this, but your beneficiaries, you know this, that you may have to pay 20% of the approved amount, and your Part B deductible applies. So if you have a Medicare Advantage plan, you know that you may just be paying a copay. So the virtual check-ins allow you to talk to your doctor, your nurse practitioner, your physician's assistants without going to the doctor's office. So ask your doctor if they offer telehealth options. That's really important during this virus. Unfortunately, the scammers have figured out how to commit fraud with this process. Although we really want to stay healthy during this time, so talking to your doctor on the phone is important. But a California senior got a call claiming to be from Medicare. She provided the caller with her personal information. She received braces. She actually received knee, shoulder, all the braces they could possibly send her. Medicare was billed for the telehealth services. So she thought she was getting a call from a medical person, and it was actually a scammer. She received a $25 bill from a Florida company. Medicare paid Nebraska equipment vendor thousands of dollars for her knee, back, shoulder braces. Her Medicare records were falsified. So unfortunately, what happens if your Medicare records are falsified, then down the road, if she were to need any of these braces or the braces for her shoulder, knee, or back, then she wouldn't be able to get them because they've also given them to her at this point. So any legitimate claim that she has will actually be denied. So contract tracing scam. As we look for ways to stem the COVID tide, we are implementing contract tracing across the country. Now, scammers are pretending to be contact tracers. And they are saying that you may have been exposed to COVID-19. And they're basically looking for your numbers. Again, your birthday, your social security number, and your Medicare number. Actually, legally, the government may call you, email you, or text you. But some scammers are saying that they're legitimate and say that you've come in contact with somebody that has COVID-19, and they will ask you for names and places and people. So if you want to check this, you have to check out the links. You can get on Medicare.gov, which is important, and find out, just how, if they're doing some contract tracing. One of the things you do is they will not ask you for your Medicare number when they're doing contract tracing. So real contract tracers will not ask for money. They won't ask for your social security number or your Medicare number. Contract tracing does not require banking or credit card information. Those are important numbers that you do not need to give out to anyone. Real contract tracers will not ask you about your immigration status. Do not click on links or text messages. So if this happens to you, what we want you to do is contact our local public health with questions, the Stanislaus County Public Health Department, for public information, and there's the phone number, 209-558-7535. So I want you to have an opportunity to write that down, the 558-7535. So my recommendation, if you think you're being reached out by a scammer, is to hang up the phone. Don't click on the text. If you feel like you've inadvertently given out your information, please call us at the Public Health Department and at the 558-7535. So I just want to tell you that we've been hearing a lot of rumors for people who have not taken the test in this county and they're receiving positive test results. If this has happened to you or someone you know, please again call this health service agency at 558-7535, or you can email HSA COVID-19 info@schsa.org so this incident can be investigated. Also, we have another link at YouTube. Okay. Wanted to make sure everyone had an opportunity to write down that phone number. So you want to be aware of fake COVID websites. There has been 1,000% increase in fake COVID websites. So we have to be aware of them. They're really just trying to get your personal information. There's emails that say coronavirus pandemic survival guide, save yourself and your family. You don't want to click on that. There's an email that says there's a supplier in China offering personal protective equipment like hand sanitizers and masks and thermometers. You don't want to click on that. You don't want to open that up. And then there's a text. This one is kind of interesting, and it has happened. You'll get a text that the truck was at your house today. You weren't home due to COVID-19. We can't leave your package. Please contact us immediately. You're sheltered in place. You were home. This is just a text. So this is something you don't want to respond to also. There's sites appearing to come from the CDC or charities. There's malicious websites offering COVID-19 maps, which may download malware. And that's not going to help your computer at all. We have to be careful. How do I know if I'm getting a message from the CDC? You can visit your government websites directly. That's the important thing to do. So the government stimulus check, this is another fraud situation. And the bad guys are looking for money. So you call, email, or text a social media message, or you receive this, IRS needs money or personal information before sending your check. That's not accurate. You get a text, $2,500 is deposited on your bank for emergency relief. But don't respond to that one either. Callers ask you to sign your check over to them. Clearly, that's not what you're supposed to do with your check. You'll get an email, text, or social media message asking you to verify your personal banking information to speed up your stimulus check. They don't have that information and you don't want to give it to them. You receive a fake check and then the sender tells you to call a number to verify your personal information in order to cash it. No, that's, again, you don't want to respond to that. These text messages and emails, don't open them, don't respond to them. So fraudulent COVID-19 products. There's been an explosion of phony cures and therapies. The Federal Trade Commission has sent hundreds of cease and desist letters to over 250 companies that claim to treat or prevent the virus. These are fake products, therapies, treats, or to prevent COVID-19. There is no approved COVID cure or therapy at this time. And as an example of some of them are musical therapy. They would offer drinkable bleach. What scammers will do to unsuspecting seniors, all just to make a buck. There is no approved cure at this time. So if you see anything like this, don't fall for that scam. Genetic testing. In 2019, the scammers last year were offering genetic tests, cancer screenings. They really just wanted your Medicare number, a simple cheek swab, and a test on, on your record. And then Medicare was fraudulently billed lots of money for these tests. This year, I'm just saying Texas was actually, a marketer was charged there, and I'm sure it's happening in other states, but this is one state where he was actually charged with millions of dollars in COVID test fraud. So they're doing the tests, then charging people and billing Medicare if they can get your number. They hire recruiters to go door to door to solicit the elderly and the poor and try to convince them to do the swab. They pay recruiters $150 for every senior's Medicare number and DNA swab that they can get. Don't give up that Medicare information. These people are just trying to make money. They have been charging Medicare over $30,000 for each test, and that we don't want them to be able to scam any more people. So COVID-19 health plan scam, marketing misconduct. We have telemarketers that try to sell plans to people who have lost their jobs to COVID-19, looking for affordable health insurance with benefits from a company that sounds like a name you know. And then if you press 3 to talk to someone, you start talking to an agent that's offering you a health plan with a different name that you've never heard from or heard about. They promise consumer full benefit coverage for bargain basement prices. We recommend you calling the local HICAP office for health plan options. We offer free, unbiased information on Medicare and Medicare Advantage plans. The Stanislaus County HICAP office, the number is 209-558-4540. We're at the Stanislaus County Aging and Veterans Center at 3500 Coffee Road, Modesto, 95355. If you want to take a moment to write down that number, it's where the HICAP office is with Aging and Veterans Services. So defense tips and beware. Beware of robocalls, door-to-door solicitors. You want to beware of them. You want to share with your friends and family. The more we share, the less victims we will have. So if you have a question, somebody's called you on the phone, you can contact your own doctor. And the phone is the biggest, most effective way that scammers have been able to victimize seniors in their 70s, 80s, and 90s. So we want to encourage you to call your doctor. Don't just accept the phone call and you don't want to give your information out. Watch out for fake cures and therapies. You can check with the Federal Trade Commission on this website, www.ftc.gov. Ignore offers for vaccines. There are no vaccines at this point. Ignore contract tracing calls. Call your county public health when in doubt. If they ask for private personal information, you're able to, the scammers just basically want your private personal information and your bank information. Watch out for email texts claiming to be from experts. There are legitimate charities, many legitimate charities, but watch out for the phony ones, all right? That's important to watch out too. So defense tips, be cautious when ordering medical supplies. Remember, Medicare will never call and ask for your Medicare number or your Social Security number. Medicare calls you, they already have it. Ask your own doctor to assess your condition and prescribe equipment. Never sign a blank form from healthcare provider or equipment supplier. Don't accept delivery. Don't sign for the equipment. Supplies you received that you didn't order. And that's really important. Defense tips. to check it out. Beware of telemarketers selling health plans. Insurance companies with no former relationship can't initiate a call unless you've asked them to call you. You contact HICAP for unbiased, free Medicare and Medicare Advantage plan information. Verify telehealth appointments with your doctor. Talk to your doctor about them. Review medical statements for errors and fraudulent billing. Your Medicare summary notice is sent out if you have Medicare and a supplemental plan. They're sent out quarterly. If you have a Medicare Advantage plan, they're sent out monthly. And if you have a question, call your doctor or call us at the HICAP office. Defense tips. Keep current with Medicare scams and healthcare fraud by calling us at 558-4540 and the County Health Service Agency at 558-7535. You can report the bad guys so we can get them out of circulation. So information is awareness. If people are aware, they're far less likely to fall victim to a fraud. So again, what should I do if I suspect somebody's trying to sell me a fake test kit, cure, or vaccine? Report it. Keep current on your Medicare and call our HICAP office at 558-4540. Also, as a final request, please share this knowledge with your friends, your family, your relatives. The more they know, the less likely they will be victimized by the fraudsters and scammers. Protect yourselves, protect others. And thank you for your attention today. And thank you, Kristen. And I want to reiterate that by calling the HICAP office at 558-4540, we can report any fraudulent activities that may have happened and assist you. And that's so important to protect your information. And I know Kristen is now setting it up so that if you have questions that we can answer them.
Hi, Sandy. Can you hear me?
I sure can. Thank you.
Okay, thank you for all that great information. I know there's a lot of really important information in your presentation, including phone numbers and websites. And so just so that everybody knows, we are recording this presentation and we will share it, so you will have access to this afternoon. And we will also send an email to all of the participants today with this information, so you can go back and find those vital resources if needed. We did have a couple of questions throughout this presentation. So to get started, the first one was, can we have a copy of this information? Yes, you can. It will be delivered to you shortly. The second one is, if contacted by a contact tracer, what exactly will they ask?
If you are contacted by a contract tracer, they're going to ask you where you've been, who you've been exposed to, if you've been out shopping or if you've been at a party. They're going to want to know what your activities have been. What they don't need is your Medicare number. What they don't need is your bank card number. So you will know the minute they start asking you for that personal information that it's a fraud call. And you can call us and let us know if you can write down their number. Not always are they going to be calling from an accurate number. There's systems out there that they can make it look like they're calling from the Social Security office or calling from an agency. But if you question it, if they start to ask you your personal information, there's something wrong.
Thank you for that. The next question is, should we call HICAP if we are uncertain about test offer or suspicious email/mail?
If you have a suspicious email, the best thing to do is just delete it, okay? The only time if you fall victim, we definitely want to speak to you. If you're getting multiple phone calls, these scammers are not paying any attention to the do not call list. They call you anyway. And when one scammer was questioned about why is he doing that, he said, well, even though they don't want to call, they may have changed their mind. So I'm calling all these people so I can make some money. So they're not paying attention to the do not call list. So the best thing to do is just erase the email and not respond to the text or any voicemail message that they leave. If you give out your information, we do want to hear from you so we can assist you to make sure that they haven't committed fraud on your Medicare number.
Okay, wonderful. Sandy, if you could click to your next slide for me, that would be great.
Actually, my slides are done. Okay.
There was one more comment that said, thank you, Sandy, this information was very helpful. And if anybody will have just a couple more minutes here, if anybody has any additional questions, you can either raise your hand at the screen. There's a little hand. You can raise it and I can unmute you, or you can type a question into the chat field. So we'll just wait another moment, see if any additional questions come in. In the meantime, I'd like to invite you to our next Community Connections. We actually have 2 scheduled. One is on September the 17th, and it is in regards to estate planning during COVID-19. And then we will be joined by Sandy again on October the 14th for planning for Medicare open enrollment, right before that open enrollment date. So she'll have all the most recent resources and things you need to know about Medicare open enrollment. So I don't see any additional questions at this time. So Sandy, we'd just like to thank you for taking the time to present today and share all these valuable resources with us. Again, thanks to all of our participants, and we hope to see you soon.
Thank you, Kristen.